We are live. I am back with Dr. Alan Chen. It is another episode of Alan Squared. How's everybody doing? And today we are going to talk to you guys about how universal healthcare would bankrupt America. So, Alan, how the fuck you been?
Been good, man. It's been a busy summer for sure. And yeah,
Yeah,
let's just
you've
get
been
right
running,
into it.
real.
I've been everywhere, man. It's
Yeah, you've been really pushing.
trying to dodge the uh, what we're going to talk about right now is how healthcare is going to bankrupt us. We're going to try to dodge that storm
Yeah.
that could be coming.
Well, it is. I mean, I just don't think people paid enough attention that it will. Like, I'm going to pull up a few charts that I put together for, and I always try to preface this with, I do preface everybody, like when either myself or anybody online talks to you about numbers, talks to you about data, talks to you about anything,
Yeah.
I will be the first one to say, please, and I mean this, especially if you disagree with me, please back check my numbers. Like, back check. Feel free to back check me, because I I think we're stuck in a place where it's like people that are just very analytical and go by numbers are having a hard time getting through to the people that are all feelings and stuff like that.
Mhm.
But universal health care. What have your thoughts on it been in the past?
Well, here's a very funny point. It was taught to us in medical school, and it was touted as the next big thing, like like sliced bread. It's
Uh-huh.
it that's and actually what was really nice. I do remember this very vividly in medical school. It was
Uh-huh.
the CEO of the hospital that I was at, that was attached to the medical school,
Okay.
who was talking about universal healthcare and how it's good, blah 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 blah, just saying all rah rah universal healthcare, socialized healthcare, all that. And then we thankfully had a group of outspoken students actually who were arguing against it, and this was actually kind of nice, is that he got them in a room to have lunch, and then they were debating it, and it was actually kind of nice. Like they actually got a debate, like a kind of like a nice, like cordial conversation out of it, even though it was kind of
Yeah.
heated during the class that we taught it at. But yeah, I mean,
Right.
it's I can imagine that medical schools are pushing it to the doctors, or at least like kind of like not brainwashing, but like sort of planting the seeds of like, oh hey, universal healthcare is the shit. So yeah, and my opinions of it were kind of neutral. I was just like, I'll just do the best job I can as a doctor and hopefully not have to worry about the
Yeah.
rest. And that's me being naive, obviously. But um yeah, obviously now it's way different. I mean, I agree with you, it's going to completely bankrupt us, and we're about to see why.
Yeah. I mean, I used to be a very, 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 like 10 years ago, I was a very strong advocate for universal health care.
Oh yeah. Oh really? Okay.
Very, very, very strong. And then like you start really digging into statistics and stuff like that.
Hmm.
And then I was just like, and 10 years ago, and I know people don't believe this and we still go by the 42% obesity, but 10 years ago, people were not nearly as fat as they are now. That number is nearly 10 years old, by the way.
Oh yeah.
So people are way fatter than 42% by BMI. By visceral obesity, waist to height obesity, we've been morbidly obese for a decade or more. But
Yeah.
I started seeing those statistics, and then it's like you realize what it costs. Now there's also a lot that goes into this, and I'll be the first one to admit it. The healthcare industrial complex is bloated with about 50% of all healthcare costs is administrative, basically.
Mm-hmm.
Meaning like people like how people like me, like people what I used to do. I was a an executive level manager, basically. So like I was administration, right? I hired people, fired people. I did all those things. I set policy. I was an administrator, right? For many places nutritionally, but I could also have been like a long-term care administrator or anything like that with my licensure.
Do you
And
have that stat, by the way, that
start,
there's a graph that shows like the level of how much administrators have like absolutely gone through the roof? Do you have that stat?
well, I don't have the stat, but I can tell you this right now. It looks very, very, very similar to this
Yeah.
stat that I can share. So give me 1 second.
There's a graph. There's a bunch of
Very,
graphs you can find on Google right now. Like it's just the growth of
yeah,
physicians, administrators. Oh, it's absolutely staggering.
yeah. Well,
Yeah.
this is
That alone.
this this will show fairly close to what administrative costs have grown by too. But this that I'm about to show everybody right here. This is it right here. All right, so if we take a look at it, man, like this is, oh, is it going to do it? It apparently is not going to do it.
Okay.
Second, it was just totally rude to me. It literally just told me to fuck off.
This is live, folks.
This is live. Literally told me to fuck off.
Yeah.
Here we go. I'll be able to do it from here. But this is just kind of what people need to look at, right?
Yeah.
This is the hypothetical that I put together recently, right? Let me pull it up. This is all sorts of stuff. This is how I talk. This is how I learn, basically. But this is. Let me scroll back up to these. Okay. This right here is a chart that shows the U.S. per capita healthcare expenditure in $2025 from 1940 on. So per capita, for every U.S. person, we spent $2,000 total healthcare in 1940. 2,000. Okay.
That's like pennies.
Yeah, pennies, right? Now it's well over 16,000 in 2025 per capita. Okay. So I'm going to make these arguments. First of all, the healthcare we would want to universalize is horrible healthcare. Clearly. Okay. Because like, if you take a look at this, everybody can be like, oh, well, we pay more, so we're healthier. That's actually not the case, because this is the trends for the red line right here is the overall chronic illness. The blue line, this one, is the per capita per capita healthcare expenditure in 2025 dollars. So the overall chronic illness epidemic completely matches basically the expenditure, the per capita expenditure. So the more money we spend per person, the sicker we are becoming.
What does that tell you guys?
And again, and I really do want everybody, please double check my numbers. I want you to double check my numbers, because if you double check my numbers, you'll see that they are correct. And then you will be unable to lie to yourself about it. Like you at least will know the truth. You can lie to public still and not believe it, but these are the numbers. Like this is what it is. The more we spend per capita, the more unhealthy America becomes. It's so crazy, dude.
Yeah. You think it'd be the opposite, but nope.
It should be the opposite. Now, here's a hypothetical situation where if the U.S. per capita healthcare expenditure and chronic illness prevalence with ideal lifestyles, everybody's getting eating whole foods, avoiding ultra-processed foods, plenty of sleep, stress relief, and sunlight. Right? That's what I programmed in for it. Right? From 1940 to now, it only goes up basically $1,000. It's insane. Per capita cost of living. Yeah. And the chronic illness epidemic pans off too, because people are eating healthy. We basically, the more healthcare we need, the sicker we are going to be. They're not curing at the very least. It's not curing anybody. It's not making anybody healthy.
Mind-blowing.
Right? So I mean, these are all just the numbers. Like this is the actual versus hypothetical U.S. per capita healthcare expenditure from 1940 to 2050.
Oh my God!
So if we keep going, this is where it's headed.
We're fucked.
Fucked. It's impossible to have universal healthcare when. Hang on, I did other stuff too. I checked other things too, where it's how much out of pocket it would be just for the healthcare. Let's see if I can find that one. Oh wait, here it is, right here. Check this shit out. Per capita cost is NHS. I think I did a different one here. scroll back up. Per capita costs, because it's super interesting. Per capita expenditures in dollars. So and then if you go to taxpayers, like just what the taxpayers would have to deal with, that's where it gets wildly insane. I'm going to take this one down and I'll find the taxpayer one that I put together too, because it's wild. It's what are your thoughts on all this?
I mean, I see it. Number one, I mean, it kind of jives with what I see in the real world, and yeah, I mean, when it goes with not just healthcare, but whenever the government intervenes and sticks their necks into wherever the hell they want, like you can see like how everything just falls to shit. Like we can name that program, name that 3-letter organization that just absolutely fucks up something that's we once upon a time was actually kind of nice, but then now it's just like, oh, it's all, it's now covered in shit. So yeah, it's healthcare is no exception to that rule. Absolutely. And then one more thing, if anybody wants to witness what universal healthcare would be like in the United States, visit a VA hospital, the Veterans Affairs of Hospital. Have you been to one?
Point. By the way? Yes, it's horrible.
Yeah, like it's you're in line to get a primary care doctor. You have to like wait in lines. You're not going to get your diagnostic studies. Like it might take you months to get certain ones. It's pretty bad. And then the hospitals, a lot of them are very dirty and like they just like I'm questioning whether they actually clean the places. Yeah. So that's what it would look like in the United States. You just go to a VA hospital.
So something else I also like to point out to everybody, right? When we do talk about universal health care, we're talking about it being either completely taxpayer funded or taxpayer borrowed money funded. So meaning like one way or the other, it's in the name of the taxpayer, right?
Yeah.
So people don't realize this either, but there's only about 114 million people in America that pay taxes. Out of the 350 million people we have, there's only about 115 million people that pay taxes. And that's understandable because some of these people are elderly and a lot of these people are too young. So, and a huge portion that are in the center are lazy fucking people that try to live off everybody else anyway, right?
Right.
But out of those 114 million taxpayers, those would be the people that would need to pay the taxes for universal health care. So 114, if you take, we're going to spend $5.7 trillion this year in healthcare, which is, I literally almost just vomited saying it.
Jeez.
Like it almost spewed,
Yeah.
So if we spend 5.3,
just to put it in perspective, like we have 0 trillionaires right now in the world, and you take, I think we have some people that are like maybe 800 million or something like that, but like even they can't pay for any of it. Like can't even pay for 20% of it. It's crazy.
Yeah. Thousands, millions, billions divided by 114 million.
That's going to end up being like,
so right now it's 46
about 50 grand.
46 to $47,000.
Yeah, about 50 grand. Yeah,
just to pay for health care for taxpayer health care. That's untenable. That's untenable for the taxpayers.
That's not even average. That's not even like the average yearly wage of the American.
No,
I think, or maybe it might be just a little bit below it. I don't know, or not even.
Yeah,
again, we got to pay for other shit too.
Yeah. Well, and imagine it keep going up because by 2030, we're probably going to be spending $7 trillion a year in healthcare unless we fix shit. Like people are trying to pretend that because we have Ozempic and Wegovy, like people are trying to pretend we're getting healthier. We are spending more money every motherfucking year. By a lot now that we have Ozempic and Wegovy, by the way. Like they're adding to it. Like there's a reason why last year we spent $4.5 trillion and this year we're expected to spend 5.3. That is an enormous jump up in cost. Like enormous. Like that's, God, people, that's close to $1 trillion. Like in jump up per year. By 2030, we're going to be spending $7 trillion a year in healthcare. It's unmanageable. The current allopathic healthcare system cannot possibly be a universal healthcare system. Like there
Not
can
right
never.
now.
I would argue never. There can never be a universal healthcare system that is just allopathically based, because allopathic medicine in itself has inherent risk. For goodness sake, the healthcare industry is one of the leading causes of death. 371,000 people a year die from medical error. This doesn't include all the combination errors that comes with medications, over-the-counter medications. Like, if we truly looked at it, like what we are set up with right now, allopathic medicine is truly a miracle when it comes to broken bones, acute illnesses, acute disease, and stuff like that, right? But when it comes to taking care of the health of the population, you are trying to medicalize and pharmaceuticalize a lifestyle thing. And that's why it's just completely like, it's to think that all health needs should be met with the healthcare industry is honestly ignorant, because very frankly, it's not even set up to take care of most of this shit. This is what it looks like piecemeal together, you know?
And it's already happening. I mean, I've seen lately on my feeds, a lot of Americans are already struggling to pay for healthcare. Like, it's already,
yes.
I mean, I think it's making people bankrupt already. Like, and then raises are a figment of everybody's imagination now, because like, well, you got the raise, but now you got to pay more in healthcare. So did you actually get a raise, or did you actually get a pay cut? You know,
it's wild.
It's already happening now, and I'm sure some people in the comments can relate to this too. It's just like, where the hell did all my money go? Like, you know, it's just for nothing really. Like, for worse healthcare, you know.
Exactly.
Yeah.
I mean, it's insane. It truly is. It's insane. So I wonder, you know, I wonder why people can't see this. Like, why we still have people even like, not only do we need to get to the point where people realize that universal healthcare is just a pipe dream at this stage. Like, that's a crackhead dream right there. That's no shit. It is so far beyond unmanageable. You guys have not, like, if you think it's a realistic thing, you literally live in a world that has a purple sky with a rainbow and a unicorn dancing on the rainbow, shitting out glitter. Like, I mean, it is that far away. And again, I think, Alan, I think you put it very, very well. The VA, like, extrapolate on that. Tell people what you mean by that. With the VA comment.
I've worked in VAs as a resident, and if you thought like your hospital, your civilian hospital was bad, like the food. Let's not even get to the food was just like, what the hell is this? Is this even food? The nurses didn't really care, because they're all paid, you know, according to, they're all structured as same as a government would. So like, you know, kind of, it's like letting the time pass, and you may not get things done as quickly as you need to be. You know, surgeries, like if you met your quota, like you don't, there's no like incentive to do more work. Like, there's just the incentives are not there for the practitioners and the healthcare providers to do more work. Essentially, it's run like the government. Essentially, weekends, you know, if you want to get anything done, forget it. I mean, the one nice thing about it was, you know, maybe nice for me, but maybe not nice for you guys, is that it was a great place to train, because the residents basically were running the hospitals, and the attendings were kind of just like, oh, okay. I mean, just like kind of the background, just like, okay, sure. So it's a great place from our standpoint, but like, you know, it's not the same as where if you pay top dollar for like a, you know, Johns Hopkins or something like that, it wouldn't be the same. Now, it could, I mean, you could argue that we get the same results, but yeah, it's just not a pleasant place to be, and in ways, it's very kind of dark and depressing because this is the way we treat our veterans. Also, I mean, that's shame as well. They deserve better too.
Well, we also do live in a country that, you know, teaches young people to hate veterans. So, which is truly fucking disgusting. But that's a whole other live. You know, what do you think would be like? Because I would love the idea of people don't have to stress if they're in a car accident. Like, they don't have to stress about that. Like, I don't think that that's a fair stress for people. Like, you know what I mean? Like I view the government very, very differently than how other people view the government. Like, I think the government should take care, like, they should make sure we have free water and free energy. Like, these are necessities in our world. What the fuck do our taxpayer dollars go towards? Like, and if you're not going to do that, let me keep all my money and I'll set myself up to grow my own food, collect my own rain, and have my own power, right?
Yeah.
Yeah, which would actually be, by the way, that's how every house should be built in America. Every house should be built to collect rainwater and to have its own solar, and it would help out the power grids and all like that. Whole other different conversation. Fucking true.
No, that's actually a goal for my next house that I'm building. But yeah, no, it's
oh yeah,
I agree with you on that one. Yeah, for sure.
Yeah, we homestead here, but if the next place we go to, I'm going to be like grid, like awful.
Yeah.
Like
that's true freedom, right?
You gotta, by the way. Yeah. Oh, it is. It's true freedom. Grow your own food, collect your own water, and produce your own energy. Mm-hmm. That's and then hunt on your own land. Mm-hmm. I mean, that's true fucking freedom, especially if that land is like you got to travel 5 miles on a dirt road to get to it from the main road. Yeah, because that way, if you show up, if you show up for me, I know, like definitely text first, you know, like, because like, oh, hang on a second. So, who's Fino?
My Serbian friend. That's RSD, by the way. Serbian dinars. That's about that's about $1 in the US.
Oh, that's awesome. I take any of it.
Yeah, shout out to Philo. He's been a great help to me with my channels and all that. So yeah, good to see you, man.
Good. That's awesome. That's awesome. But yeah, I wanted to get like a doctor's perspective on this because the argument is really, really, really rising up. You know, and I think it's rising up because RFK is getting like he is having mRNA vaccines removed and blah blah blah. So like, and he's still way behind, if you ask me. Like again, I'll say this every time it comes up. Stop the healthcare commercials on TV, and the world changes. The world literally changes. You know, like it shifts so much money, people have no idea, and it takes away narrative control. But anyway. But I just wanted to have a doctor on, like, for your perspective, dude, because I think you like, I think every doctor sees it. Like, it's too much money. Like, I mean, I think people really see it. It's too much money. Yeah. And you guys don't get paid for, like, when doctors move into administrative roles, they either become completely evil motherfuckers who are trying to get every dollar, or they leave the industry. Mm-hmm. As soon as I was put in charge of like serious budgets, it started wearing on me to the point where I was like, this is disgusting. Mm-hmm. You know, it's just gross, right?
Yeah.
So, but
yeah, from a doctor's perspective, I think there's a subset of people who understand what's going on, and then they're either one going like this, la 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 la. They're just not like they're just like ignoring it, and is or if you're kind of in my boat, it's like that scene from Indiana Jones with the big rock that's like tumbling down.
Right.
Like it's just, you just got to avoid it. You just got to get out of the way. Yeah. You can't stop it. There's no way to stop it.
Yeah.
It's, I mean, that's sort of where I am with that. And the other thing is that I think most of us don't realize what we could do to mitigate the problems, at least from how we practice standpoint. I know we have very defensive medicine, which ends up becoming very expensive medicine, where you test up the wazoo for a cold, chest X-ray, labs up the wazoo, and sometimes even a CT for fuck's sake. You know, and it's also at the trying to trade it for speed as well, trying to get the ER wait time. Sometimes speed, haste is waste, which is very much the case in healthcare. You know, we're trying to rule out every, worst possible scenario. And sometimes the worst possible scenario is like the zebra, but we're still trying to rule it out, because if we miss it that one time, we'll get sued by, the lawyer in a box somewhere who has an ad on the street. It's very defensive medicine, which becomes wasteful medicine, which becomes very expensive medicine. And that's something that it's hard to break that. Like I'll admit that I practice defensively as well. I try to do my best to, when I'm sure of myself that I'll just go out and say, hey, this is this diagnosis. But sometimes I have to hedge. Sometimes I have to like say, okay, maybe you should do this to make sure, that kind of thing. It's the game that we have to play all the time is the cost versus the benefit. It's a game that we constantly play. It's just a matter of what level of comfort we are in terms of how, honestly, like how skill. It's basically comes down to how confident we are in our skills, I would say. You can sort of tell folks who aren't nearly as confident when they're trying to either hedge or trying to dig too deeply or like looking for the zebras and all that. Like it's just they're just way off kilter with that. So and unfortunately, I mean, we talked about this before, like the training. I think we are graduating medical students and residents who are way less and worse trained than it was 20, 30 years ago. And they're also, not as battle hardened, if you will, because of the hour restrictions that we have, and all this, like, the watering down of education from medical school level and beyond, where now the folks that are coming out as attendings are less prepared for what they're dealing with. So all that in a nutshell, from my perspective on like why healthcare is expensive, wraps into play. And then I guess one last point, physicians, I mean, like for whatever reason, people were like, oh, physicians get paid too much, and then it's somehow the government kind of ran with that, and our reimbursements have gone down consistently over the last, like, oh, God knows how long. They've never really gone up by any stretch. And yet cost of living still goes up. Our student loan debt keeps going up. All these extra costs for administrative costs, for licensing, for certifications, it's all going up. Like, who's really winning in this? Like, it's not the physicians.
Right.
Yeah.
Right.
Yeah.
So I really appreciate your time, man. I do know you need to get on the road and get driving, so we can wrap it up right now. But
I'm good. Yeah.
All right. So I tell you what, do you want to join me on my next one for a little bit?
Oh yeah, let's do it.
Because I like to break these up in segments. We wanted to do something funny, so I will send you the link.
Let's do it.
Right now, we'll go. Okay, we'll be right back, guys.
Sounds good.